and calendars. Anyways, Dr. Kelly OMD, and if you want to follow me, you can follow me on social media on Viva Life Health Hub. That is Viva, VIVALIFE Health Hub, and that's on all my social media channels. So Instagram, as well as Snapchat and Facebook, of course. Also, if you wanted to join our group, you can go to Viva Life Health Hub. We also have a private group that we utilize for motivation, spreading great information, evidence-based information, and then also just having a community together so that we can make sure that we are healthy, happy, and prosperous. That's the goal each and every day. So I've written down a couple of notes that I want to make sure so I can make sure I get the shout outs. One of the things that I must say to my absolute best friend since the fourth grade and her daughter, we call them Lady Boss and Little Boss. Happy birthday. Congratulations. You are doing wonderful and excellent things. You are a supreme best friend, mother, friend, wife, and activist in our community. I admire you so much, and I know your little lady admires her mother as well, and is going to be a super fantastic mini me and even better. So happy birthday to you. Also, as you know, I very much support small businesses, specifically women-owned businesses. To make sure that we are supporting those businesses is so important because it goes with the whole economy of making sure that we are spreading the wealth amongst all people and amongst our generations. So some of the small businesses that I want to shout out, of course, my career strategist, Tanya Sloans. As you can see, I have my Fijian pearls on, and these are important because I'm not sure many of you know I have been supporting a program called Med for Our World for several years, but this past year I was able to go on a humanitarian trip where we serviced a number of women in the GYN arena doing surgery for these women, and it was amazing. It was also amazing to see how they managed their maternal health on the Fijian Islands. Met over 50, really over 100 women, did surgery on 25 women, and these were major surgeries. So we're talking about hysterectomies, we're talking about laparoscopies, which is when we put cameras in belly, we talk about hysteroscopies, and it was all free. And so I just want to thank Med for Our World as well, because this is an awesome experience, and I felt so connected, and I felt like my skill set not only increased, but also my heart grew bigger. And of course, I mean, where can you have a better experience than on a Fijian island? One of those things when I was a little or younger, I was like, I want to go and I want to experience this, but I thought I was going to experience it as a vacation, but this was more than a vacation. It was a blessing. That's really what it was. It was a blessing not only for the women that I was able to treat and the people that I was there with, but it was a blessing to be blessed. And that's essentially what I was. I was blessed. So I just want to thank Men for Our World for that. Tanya Sloans, wearing the Power Woman. Tanya Sloans is a career maximization strategist. So in my career, people ask me all the time, how did you get where you are? Well, you have to have mentors, you have to have colleagues, you have to have advisors, supporters, and she is one of my advisors that I utilize to make sure that I am doing what I need to do to continue to move forth in this world. Hey, Tanya Sloan, thank you for joining. So if you want to follow Tanya Sloan, she's actually on here in the comment section, but you can go to IamPowerWoman.com, I believe. But Tanya, you can also add your hashtag in there and everything for that. If you want to advance in your career, if you want to make sure that you are making a difference in what you do every day, I suggest that you contact her. The other thing that I want to recognize is Shakur Bella. She is having an event this Saturday in Southern California. It's a natural hair event, but it's more than that. It's about how we can treat our bodies in the most natural way, so we can be prepared for anything. I'm not sure if you are aware, but I stopped what we call relaxing or perming our hair. This is something that's pretty prominent in the Black community. And I stopped doing that probably about 15 years ago. And the reason why I stopped doing that is because I was preparing for, actually, I didn't know at the time, but I just knew that I wanted to be as natural as possible. So that meant that at one point I had cut off all of my hair, all my beautiful, lovely hair that had been relaxed for many years, either in a jerry curl or a relaxer, perm, or whatever. And I just figured that why am I putting this no lie relaxer, or why am I putting this in my hair, and it could be causing issues. So as we know, women of color have increased risk of having fibroids, and that is one of the things that we found. Those chemicals in those hair products could be causing us to grow fibroids and other types of tumors. So, I said, I don't want that. And it is a struggle. I will not lie. It is not easy to manage natural hair if you don't know what you're doing. And I personally did not know. I'm a physician on women's health. Yes, uterus, ovary, tubes, and breast. However, my hair, I was like, I don't know what to do with it. I can wash it and I can put some stuff in it, some juices and berries, and figure out from there. So Shakur Bella, like I was saying, is having a natural women's expo this Saturday in Southern California. I hope people that attend that. She was one of the people that contributed to our swag bags, VIP bags, at our Viva Life Health Hub, which was a magnanimous success. So if you didn't know that, it was. We're still going to be posting about that. The other thing that I wanted to mention, let's see. Like I said, it's Femme Friday, and my fitness coaches. So I'm back. We are starting a new regimen. I am so excited because it starts tomorrow. I'm going to go in the gym today. I'm going to play basketball, which is what I do on Saturdays. But tomorrow I'm going to start a new fitness regimen. So I got to get these abs right, because I just saw somebody that had these magnificent abs, and I'm like, oh, I need to have those. Back in the day, I used to have a 6 to 8 pack, and it went away a little bit. So I got to get it back because it's just too sexy. It's just too sexy not to have pretty abs. And so that goes into Labor Day. So Labor Day, we're going to be talking about Black women's maternal health, and why it's so very important that we prepare our bodies for prior to pregnancy. And I mean, not just that, if you're preparing your body to be as healthy as possible, whether you're trying to get pregnant, you've been pregnant, you're post-pregnancy, or you don't even care at all about getting pregnant, I mean, you're just setting yourself up for success. I can't 100% say you are not going to get a major diagnosis. You're not going to get cancer or anything like that. But you will be fully prepared, and hopefully you will be preventing any advanced stages. So in talking about that, we talk about nutrition a lot. And I know people are doing different types of methods to make sure that they are having good food in their systems. I hope that we're all trying to do as many fruits and vegetables and drink as much water as possible. And I know that can get a little bit boring if you don't know how to cook. And I don't cook a lot. I prepare. My uncle gave me that. You prepare food. You're not really a chef. You don't cook. And I'm fine with that because I will throw some vegetables in a pan, and I will eat fruits, and I will try to minimize dairy. I love cheese. I will try to minimize that as much as possible or use substitutes. But we need to make sure that we're eating those green cruciferous vegetables. So I talk about this very much because when we're talking about maternal health and we talk about gastrointestinal health, I have so many people in their first trimester of pregnancy. Yes, I'm going into the maternal health. In their first trimester of pregnancy, this is known to decrease the flow of your bowels. Okay, so their bowels start slowing down in pregnancy. And I get people that come in the first trimester. We know the hormone levels are going up. So your HCG levels are going up. It's like taking a whole pack of pills every single day. Imagine all of that hormone. That's what that pregnancy is doing. And they're nauseous and they're vomiting. And then they're saying that they can't have a bowel movement because they're constipated. Well, even some of the medications that we give you to prevent nausea and vomiting can cause you to be constipated. So what I tell my people all the time, let's talk about the nutrition. Let's talk about that food. A lot of times you can't eat certain things. Your body's going to tell you what you want to eat. Make sure those things are healthy. Make sure it's every couple of hours, and make sure you have a lot of water. So my recommendations are things with a lot of fiber. So raisins, instead of taking, Colace, Ducalax, a stool softener or whatever, guess what works? Raisins. So what I do is I carry around a little Ziploc bag I'm not pregnant, by the way, right now, but when I was pregnant, and even still now that I'm not pregnant, if I want to make sure that my gastrointestinal tract is right, I make sure I'm putting the right foods in my system. So I'll carry around raisins, or if you don't want to carry around something, first thing in the morning when I get up, after I do my meditation, my workout, drink my water, I take a handful of raisins and put them in my mouth. So that's, when the doctor tells you 3 times a day, 2 times a day, that's my first ingestion of my healthy food, raisins. And then maybe at lunchtime, another handful of raisins. And then at dinner time, another handful of raisins. Granted, if you're a diabetic, we're going to have to be careful with the sugar content, but this is the thing we can do. Other thing you can do is prunes. Other things you can do is other not healthy fruits. Fruits are healthy. So other fruits. But if you stay away from those that are more tropical, then you will keep that sugar content down, okay? Especially if you're a diabetic. So the other things that we want to do is sometimes I do peanuts. So if you're allergic to peanuts, please do not do this. However, I do different types of nuts. So I do almonds, I'll do cashews, I will do actual peanuts, but almonds and cashews are my favorite. Why? Fiber gets everything moving through. Decreases the constipation that's associated with not only pregnancy, but gastrointestinal issues. The other thing, so people talk about a lot of nausea and vomiting in pregnancy. So nausea can be improved by making sure you eat those small, frequent meals, but then also vitamin B6. Now, a lot of people get frustrated because they're like, it doesn't work like if you just give me a pill. No, they have like perfected medicine, so you almost just take medicine and you feel better for a couple of hours, but guess what? You're constantly taking this medicine. But you can also be taking vitamins. Vitamin B6 is a great way to decrease nausea associated with pregnancy. So I typically take that in the morning. I recommend people to take it in the morning. The reason why is because sometimes it can give you like really expanded dreams at night. And when you're pregnant, you dream very vividly. And when you dream vividly, they end up feeling like nightmares. So sometimes when you're doing the vitamin B6, I have noticed that you get increased awareness of your dreams. But sometimes people do need that twice a day. Okay, so vitamin B6, you can take that in the morning. And if it's not working for you very well, then you can take that at night. Other things that I recommend. Stay away from those foods that make you nauseous. So some people are like, I can't smell beef. I can't smell chicken. I can't smell certain things. Well, guess what? Don't do it so that you don't get nauseous and you're not triggering yourself. The other thing is utilizing natural essential oils. So one of the things I like to do is wear a patch that is an essential oil patch. And this patch can be for anything. So when I am trying to prevent nausea or something like that, then lavender, peppermint, ginger. Okay, so you can ingest any of those things. You can also wear them as a patch on your skin. So what I do is I put it right here on my chest and then I can smell it. And then the other thing that you can do is you can use the essential oils. The interesting thing about this is I also use these same essential oils when I'm trying to minimize what I want to eat. So if I want an appetite suppressant, the sweet fennel is a great appetite suppressant. And so I make sure I either wear a patch or utilize essential oils for that. Okay, so that's another thing that can be very helpful as far as nausea, vomiting associated with pregnancy, or if you want to minimize your appetite and you're trying to lose weight or have a good nutritional balance so that you can maintain weight, you can use your essential oils. Now, if that's not working for you, you've tried all of those wonderful things in your first trimester of pregnancy, or if you have gastrointestinal issues, then yes, we can go to medications. But we're going to start with the least effective. We're going to start with hopefully the most effective, but will decrease the amount of issues that will side effects. Let's put it that way. So the profile, the medications that have the least side effects. And that starts with your antihistamines. So that can be a Benadryl. That can be a Zyrtec or a Claritin. It all works the same pathway as well. And then we go to further on into medications. And I'm not going to get into those because those medications definitely have to be prescribed by a physician. And I recommend you discussing that with your physician before you do that. One of the medications that a lot of people get into is like Zofran, Reglan. They just want something that's going to fix it. This is a process, okay? Pregnancy is a process. So that's why it takes time for improvement. There is not a magic pill. You know, a lot of times we chose to go through this, and we need to utilize alternative methods so that we don't have to take medication. The other thing I always promote is acupuncture and acupressure. I cannot give you any other alternative therapy that works for so many different things. We talked about, you know, how we can utilize our food, essential oils. Acupuncture and acupressure are like the most amazing. So find a great acupuncturist, pay the money that you need to pay to do it, because it will change your life. Okay. The other things that we want to talk about with Maternal Health Week, Black Maternal Health Week, is as we go through the pregnancy, we have found that women of color have increased risk factors for many things. So depression, as well as major stressors. So I want to just let you know, so I didn't know if anybody knew, but I actually wrote a couple of chapters in books over the years, and this is one of the books that I've written a chapter in. It's called Perinatal Mental Health and the Military Family, because as we know, our military, active duty, even retirees, veterans, go through significant changes to service the family, the country, as well as our community. And that's why I always talk about that, because that is so important to me. And the mental somersaults that people have to go through in order to be present and available and to be on those front lines, taking care of our country, no matter what's going on inside the country, so that we can have freedoms, right? But that takes a lot of mental stress. And it's not just military families, it's all families. But specifically, women of color have major stressors, microaggressions, whether it's at work, whether it's at home, whether it's just in the community that they are dealing with. And a lot of times we internalize them. So one of the things that I experienced this past week was somebody telling me that they're having significant amounts of headaches. And I want you to know that headaches are a symptom that your body is telling you that something is not right. Something's not going on. Something is going on that is affecting you. And a lot of times that can be stress. Granted, when you go into the physician, we're going to have a differential diagnosis, and we're going to rule out a lot of things. So we might get blood tests. Most likely we will get blood tests. Make sure your iron levels are okay. Make sure your electrolytes are okay. So that's that calcium, magnesium, and other things. We're also going to make sure that you don't have, signs of infection. We're going to make sure that there's no signs of what potentially could be cancers going on. We're going to ask you about your headaches. When do they come? What do they feel like? How do they go away? How do you treat them? Because we can also potentially have to do imaging. You might need a CT, you might need an MRI to look at your brain and your head, just to make sure that there's no masses that are in there, that your vascular or your blood vessels going through there and everything look okay. You might even need an eye exam, right? So if you haven't seen your optometrist, then I recommend making sure you're getting your eyes checked every year, because your eyes change and that can cause you to have headaches as well. And then of course, stress. We're internalizing a lot going on. It just depends on what's coming into your psyche. And that's why I think meditation is so important, so that you can release and let go of all of those negative things that could be potentially affecting your health and your health care. The other thing is just, depression. So what are some of the signs that could be going on as far as depression? It could be that you are not eating. If you like to work out, you don't work out. You're saying that you're gaining a lot of weight, or you're losing weight. That you are not interacting with other family members. You're not interacting with your friends. You're not interacting with your colleagues. And these are all things that can be those can stretch your body, that can cause depression, and those are all things that we need to address. A lot of Black women specifically, we don't want to talk about anything. We don't want to talk about that. And so it's really important that we stay in communication with our friends and make sure that they're doing okay, and our colleagues. I mean, look people in their eyes when you say, how are you doing today? I need you to look in somebody's eyes and answer that question and see what they're saying with their eyes. It's so important. And I think that's one of the things, being a physician, when we don't take the time with our patients, that's what we miss. We miss what is behind our patient's eyes. What is that telling us? What is their body language telling us? How are they really feeling? How do they walk into that room? How do they walk out of that room? And do they appear tearful? Do they seem like something else is going on? Ask those intriguing questions. Ask those investigative questions, and listen to what they have to say. And then when we hear something that triggers in us, like, okay, I'm hearing that you're having a difficult time, then I want you to make time for that client or that patient and take that time. And I know we're all on this 5 minute, 7 minute appointments, but we have to take that time, because you might be that one person that's going to change their life. And then changing that life, that means that you have the resources available so that we can utilize, so that we can get them the health care that they need. And those resources are very important, especially when we're talking about maternal health. They're very important. So we're talking about social workers, we're talking about psychiatrists, we're talking about healthcare navigators, we're talking about doing childbirth education classes, or doing group classes. I went to a breast cancer support group in our community. Those are all important things, because that affects our health. That affects our female health. And could you imagine being a breast cancer patient or an ovarian cancer patient and being pregnant at the same time? It doesn't happen very often, but it does happen. So imagine that on top of that. The other things that we need to consider with Black maternal health and how we're going to be healthy throughout the whole pregnancy. And then for those babies, remember, when you're internalizing stress, you're internalizing that to that unborn child or fetus as well. And we need to make sure that we are doing whatever we can to minimize that. So nutrition, exercise, getting pregnant women in the exercise classes, asking them to go for a walk, asking them to do whatever it is to get outside, because that's going to help with depression. That's going to help with, mental stress. That's going to help with keeping you at a healthy weight while you're pregnant. And these are all those different things that we can do. A lot of people also talk about the financial strains of being pregnant or being a Black woman. And yes, it is. It's true. A lot of times our women are single, or if they're in a relationship, both people may not be working. One person may be working, even if both people are working. These are all major stressors that we are dealing with and trying to figure out. And back to what I was saying about the military family, somebody could be deployed. So you normally have somebody at home, somebody's deployed. Well, that spouse at home, it has to manage all of those stresses. And imagine being pregnant doing that. Trying to figure out, how am I going to get this kid in kindergarten? How am I going to take this child to 3rd grade? How am I going to pick them all up in the evening? How am I going to make food for everybody? How am I going to make sure that food is on the table? Well, there's resources for all of this, but in those resources, it takes time to do all of this. And it's not easy. So we need to make sure that when we're talking about us as healthcare providers, that we have the resources to be able to refer our patients to, and we have the navigators that can help our patients to do what they need to do. So we have those social workers on speed dial. We have the psychologists where I can say, okay, please, they provide virtual appointments. Please utilize them. So that's also very important. And then also in maternal health and perinatal health, we need to make sure we're going to our appointments. So prenatal care is so important that you go to your appointments. And I know it can be difficult. And one of the things that we're looking into is virtual prenatal appointments. I mean, really, why not? They have started it in a couple of locations in the South. I am hearing about some things going on the East Coast, but we need to bring that to the West Coast too. And that's one of the things that I am very excited about working on. But we need to go to appointments. You should have at least 9 appointments, sometimes 12 to 15 if you're a high-risk pregnancy. And we need to make sure that we find out early when we get pregnant. And the reason why is because it's hard for me as an OBGYN or my midwives to figure out, okay, where are we in this pregnancy if I don't know when you got pregnant? So please keep track of your periods. Please, get your early diagnosis of the pregnancy and your early ultrasound. That should happen between weeks 8 and 12 to make sure we know what's going on so we can help you through the pregnancy as well. Other things we talk about is making sure that we're monitoring our blood pressure during the pregnancy, that we're monitoring for diabetes, that you're getting your immunizations. I know a lot of people don't believe in immunizations, but I do, especially in pregnancy. I think it's so important. And then the last thing, breastfeeding. So I know this is a postpartum thing, but it's something that you really start while you're in your pregnancy. And I think it's really important to get with a lactation consultant and make sure that you understand the physiology behind breastfeeding, but then also what the benefits are. The number one benefit, and I breastfed my son for, 14 months until he's like, Mommy, I'm done. But the number one benefit is the bonding that you get. And I know that everybody is not able to breastfeed and everybody doesn't want to breastfeed, but in our community, Black women have lower rates of breastfeeding, especially in the United States. And I really don't understand that, because we are so much about, making sure that our children have everything that they need, just like any mother. But and a lot of people are like, it's hard, it's really hard. And yeah, it's just like exercise. It's something that you have to be persistent about. But the number one thing is the bonding that you experience with your children. I just can't tell you what an amazing thing that was, because as an OBGYN, the schedule is crazy. So I'm working 12 to 16 hour days. And to be off with my child for the time that I had off with my child, I only had 4 to 5 weeks off with my child at home. A lot of people are blessed now that they get 12 to 18 weeks off with their children when they're first born. But utilize that time. That's a bonding time. It's a family time. It's the only time you're going to get in that child's life. And you will notice that your child is less anxious, that your child is more interactive. It helps with depression. It decreases the risk of depression, perinatal psychosis, if you can do it. And if you're not able to do it, it's okay. But if you can pump, that works as well. So you don't have to be breastfeeding. Actually, you can actually be pumping the breast milk out. The goal is to get the breast milk. But if you can do that bonding, it's so important. The other things, it decreases obesity in children. So, you can have these people think that, I have to feed my child formula in order for them to get fat and healthy. No, breast milk. I've seen some healthy breast milk fed babies, and they are just chunky and lovable and all that good stuff. So don't think that you can't have a very healthy baby if you're not breastfeeding. The other things is you're passing along antibodies to your baby. So when you're passing along these antibodies, it's helped decrease in the likelihood that the child is going to have ear infections, that the child is going to have upper respiratory tract infections, and other, communicable diseases. The other thing is when you're breastfeeding your child, that baby is always near you. So nobody else can touch your kid. It's great. And so you're doing a lot of baby wearing as well. And it's actually very convenient. I mean, you roll over, you pick up the baby, you breastfeed, and you're done. Granted, it's going to happen every couple of hours, but it's worth it. I can't say anything more than it. It's just worth it. It is, and it's great. And then long-term, decreasing the risk of diabetes. So one of the things I'm seeing a lot of, and we know in our community, people are overweight, they're obese, and they're getting diabetes. And guess what? When you're pregnant and you have diabetes, you're passing that right on to your child. And we don't need that. We don't need kids to be significantly overweight. We don't need them to be overweight at all. We don't need them to have diabetes, because that leads to high blood pressure. It also leads to them having problems with developing eye problems, as well as musculoskeletal problems and bone problems and lots of things. So why are we doing that to our children? We don't need to. Anyways, so I just want to say thank you very much. That is my plug on Black maternal health. It's very important to get a great healthcare provider. Your healthcare providers should be board certified, as well as certified in what they do. So whether that is a certified midwife, or a licensed midwife, or that is a certified nurse midwife, or that is a board certified family medicine physician, or a women's health nurse practitioner who is board certified, or a board certified OBGYN, then we want to make sure that you're with subject matter experts. If you have any questions about anything, you can always reach out to us at vivalifehealthhub.com. My name is Dr. Kelly, OMD. I hope you have a wonderful Labor Day weekend. Please, not one sip. Do not drink anything and drive. If you need it, then go ahead and find a designated driver. Make sure that you use a service, Uber, Lyft, your friend, I don't care who it is, but please do not get intoxicated. Don't drink, don't smoke, don't do drugs, and get behind the wheel of a car or bike ride or anything like that. So, Dr. Kelly, OMD, hope you have a wonderful day, and don't forget to do it. Viva life. Bye.